Medical remediation examples from history. A well-known medical remediation case involved Dr. William Stewart Halsted, considered the father of modern surgical education. Halsted became addicted to narcotics while in medical school in the 1870s, stemming from easy access while studying pharmacology. His addiction persisted through his professional career, affecting his behavior and disposition. In 1901, his colleagues at Johns Hopkins intervened and demanded he resign, later allowing him to admit himself to a private hospital in Rhode Island for opioid detoxification and rehabilitation over 7 months. Upon demonstrating his successful remediation through a supervised return to work, his surgical privileges were fully reinstated, and he revolutionized surgical training and standards at Johns Hopkins. More recently, a Harvard cardiothoracic surgery resident, Dr. Fishman, was found to have deficiencies in clinical decision-making and technical skills, resulting in a higher than expected surgical patient mortality rate in 2011. After assessments revealed gaps, he underwent an individualized remediation plan that included one-on-one mentoring by senior faculty, repeat surgical simulations and observations, coursework review, and increased oversight during patient care. After 10 months, Dr. K. Fishman successfully demonstrated required competencies and improvements in patient outcomes, allowing him to complete his residency training under continued evaluation to ensure practice standards were maintained. Dental remediation examples. In dentistry, a classic remediation case example is that of Dr. Alyssa Young in the early 2000s. As a third-year dental student at UOP Arthur A. Dugoni School of Dentistry, Dr. Young struggled in her patient care abilities, displaying hesitancy and lack of confidence in clinical techniques. Faculty observations of her shaky hands, rushed dental preparations, and improper infection control sparked concerns. She underwent detailed skills assessments that showed significant deficiencies. Her remediation plan mandated one-on-one mentoring, repeat dental lab sessions, and skills evaluations prior to returning for patient care after 3 months focused remediation. Eventually, Dr. Young successfully demonstrated competence. A more recent dental remediation example can be seen in the case of Dr. Bobby Fowler. As an experienced dentist in Texas in 2015, patient complaints about incorrect diagnosis and improper tooth restorations suggesting competency issues triggered review. Assessments revealed gaps in diagnostic knowledge and outdated restorative techniques. To maintain his license, Dr. Fowler completed a remediation plan that required 6 months focused coursework and training to correct deficiencies, followed by a supervised, gradually reduced oversight period during patient care to ensure proper standards were achieved and maintained. Nursing remediation examples. In nursing, the widely discussed case of Kimberly Hyatt illustrates the importance of remediation for safe practice. Hyatt was an experienced critical care nurse in Seattle who in 2010 accidentally overdosed an infant in the pediatric ICU with 10 times the ordered calcium dosage, resulting in the child's death. Practicing for over 20 years without prior incidents, reviews identified her deficient dosage calculation abilities and related knowledge gaps. Her local nursing commission ordered rehabilitation education, which upon her successful completion, allowed her to eventually regain her nursing license, though not in pediatric care. This case prompted policy changes nationwide, addressing root causes and remediation. Another case example can be seen in the 2015 remediation process for registered nurse Linda Wilson. Her hospital documented incidents of unprofessional communication, avoidant behavior, withholding patient deaths, and lying about completing continuing education courses. Assessment determined psychological issues related to personal grief were affecting her professionalism. Her remediation plan mandated counseling, communication skill building, ethics refresher coursework, and gradual supervised transition back to full duties over 9 months to demonstrate corrections. Pharmacy remediation examples. In pharmacy, remediation processes have increased with growing patient safety concerns, prescription complexity, and advancing scope of pharmacist roles. One example in recent years can be seen in the case of Michael Spencer, a retail pharmacist manager. In 2018, assessment of his performance revealed inadequate oversight and quality assurance measures for pharmacy staff, resulting in numerous medication dispensing errors. To address these practice deficiencies, he underwent a retraining plan, including preventative care coursework, one-on-one leadership coaching, and eventual supervised gradual return to management duties, demonstrating performance improvements. Another case involved hospital pharmacist Joyce Lambert, who in 2020 was flagged for deficiencies in aseptic sterile compounding procedures, potentially jeopardizing immunocompromised patient safety. Her remediation plan mandated retraining on proper hand hygiene, hazardous drug handling, contamination prevention, and sterile technique. She demonstrated improvements under direct observation by passing sterile compounding testing over a 3-month retraining period prior to fully resuming unsupervised pharmacy duties. Social work remediation examples. For social workers, remediation case examples can be seen in 2010 disciplinary action taken against NASW member Carl Rogers by the New York State Social Work Board for professional misconduct. Reviews of his mental health assessments and treatment plans revealed incomplete and inadequate evaluations, putting clients at risk. His remediation mandated detailed assessment coursework, legal ethics training, mentoring, and ultimately demonstrate competencies by completing 50 satisfactory health assessments under supervision prior to reinstatement of license. Another instance arose in 2020 when complaints of unethical practices were filed against social worker Jodie Foster, including violation of client confidentiality. Investigation into mishandling of client medical records confirmed deficiencies in safeguarding protected health information. The remediation process required corrective education in ethics and HIPAA compliance trainings, reflection statements on professional values and habits, as well as a probationary period, ensuring ethical conduct in practice under supervision prior to fully reinstating her license. In conclusion, these real-world cases of remediation across health fields illustrate how imperative oversight processes are for identifying incompetencies among students and professionals, putting patient safety and public trust at risk. They demonstrate that individualized retraining plans targeting specific knowledge and skills gaps can produce improved competencies. However, mandatory demonstrations confirming such deficiencies are adequately remediated prior to allowing independent practice must be rigorously enforced for the ultimate goal of protecting wider public interests.